Great. So good afternoon, everybody, and welcome to our Lunch and Learn. This is the third of a four-part series that we're doing through the Azrieli Adult Neurodevelopmental Center. Perhaps if you're joining today, you've already come to our communication talk and our talk on mental health assessment. And even if you didn't, do not fear, you will still be able to follow along today when we talk a little bit about treatment. So I'm really excited about our workshop today. We have a great team of people who are going to be speaking from different perspectives on this really important issue. So here's our little title page. We're talking about treatment a little bit and different options and how we can support our loved ones with developmental disabilities when they have mental health concerns. So going to the next slide. I'm Yona. I've just introduced myself, and Lee and Casey and Natasha will introduce themselves. I guess you guys could each introduce yourselves now and maybe just say quickly what it is that you're doing and the perspective that you're bringing. So I'm a psychologist and I direct Azrieli. Lee, do you want to go next?
I'm Lee Steele, and I am a parent of two children, adult children. My oldest has a developmental disability.
My name is Natasha Fernandes, and I'm a fourth-year psychiatry resident with a special interest in this population.
Hi, I'm Casey Fulford. I am a psychology resident in adult neurodevelopmental services working at the Center for Addiction and Mental Health.
Thanks, team. And Irfan is hosting, and he's going to be also working with our Q&A part at the end of the session. And then we have Megan and Tiz as well on our team working behind the scenes. So a couple different things we're going to cover today. I'm doing the introduction, then we're going to dive right in to talk a bit about some of the psychosocial kinds of interventions, as well as pharmacological interventions. And then we'll hear from Lee about unique concerns of family caregivers. And then we'll wrap it up with some final thoughts. So a couple different things I maybe just want to highlight here. When we think about treatment, I think about treatment as thinking about things that we do when someone actually has a mental health problem or maybe a diagnosed mental illness. If we're thinking about things to just help people with their mental health, that might be more like mental health promotion. But it is really important, stepping back a little bit, that before we get to the point of applying our mental health interventions, it really makes a huge difference to do that really thorough assessment. So we can do a great intervention for the wrong thing, and that's not particularly helpful. So we need to understand what it is that we're treating and really who it is that we're treating so that we can adapt and modify things as best as we can. If you came to one of our other sessions, you would have heard this term diagnostic overshadowing. So it's here again, just as a little reminder for us that sometimes what we tend to do is when someone has a mental health concern in this population, we kind of miss it because we're so focused on the fact that they have a developmental disability. And so we don't offer them the kinds of treatments that we offer to other people who may have issues with things like depression or anxiety. So we really want to try to avoid that and keep in mind things that we can do to help people's mental health. And of course, when we planned this webinar, it was prior to COVID. But as we all know, even finding an hour, I think right now to participate in a workshop like this is a big deal. It's a really stressful time for everyone, and it's definitely having major effects on all of our mental health. And that includes people with developmental disabilities. So we didn't want to cancel this webinar because we actually think some of the things we're talking about are still really important. But we recognize that how we provide our care now might be a little different. This is just a nice illustration of a video, and we'll include the link to this video afterwards, but it's showing Julie, who's used to getting her care, including her mental health care, in person. But now that there's COVID, she can't do that anymore. And so we have a video of her actually doing a virtual appointment with her healthcare provider. You can get a little bit of a sense of how that might work. I'm just curious if people can maybe put their response here or in the Q&A, who has actually taken advantage of virtual care for their loved one with a developmental disability since COVID has started, either through a teleconference on the phone or actually through video in terms of seeing some kind of mental health provider. It'd be really interesting for us to know. So you can pop your answers into the Q&A there perhaps, or the chat box if that works. And then I think I'm going to move things along to the next slide. Okay. So I think, Lee, is this the one that goes, I start with this one, right? All right. See, I need the team because they remind me what I'm actually supposed to do. Our mental health treatments have to be done sometimes in teams because we all need a little bit of help. Thank you for responding. I see a couple of people sort of typing in there that they are actually using virtual care, which is great to hear. There was just an article in the Toronto Star yesterday, I think, highlighting 750% increase in virtual mental health care at CAMH in the last month and a bit. So we really are shifting how we do our care. This visual is showing us where we go to get our treatment. And it's reminding us that there are all different types of providers we can see depending on the situation. So if you look at the bar that's going up, it's showing sort of someone who maybe has a very mild developmental disability at the bottom and a more severe developmental disability at the top. And it's saying that maybe for sort of mental health issues, especially if they're more mild issues, a lot of that can really be addressed through working with your primary care provider, like your family physician. But if the developmental disability is more complex, greater severity, you might start to need more of a specialized developmental disability team to do some of that work. And similarly, if we look at the bottom sort of line, we see here that as the mental health issue itself gets more severe, we start to go from maybe just the primary care provider being comfortable providing that mental health support to moving into a more specialized mental health team. And if the person has a significant developmental disability and significant mental health issues, it's not just a specialized provider in developmental disabilities or a specialized provider in mental health, but it's actually that really integrated specialized team that's needed. But that integrated specialized kind of team, maybe like a team of what we might have at CAMH, isn't really needed for every situation. So many mental health care providers can modify or adapt what they're doing to support people who have more mild disabilities. And then many sort of primary care providers can also apply the things that they know and that they do around mental health for people who have less severe mental illness and less severe developmental disabilities. So sometimes we use specialized services, sometimes we need that team-based approach. And also, regardless of the severity of the situation, sometimes for mental health, we really need to have resources to help us in crisis. So the purple picture at the bottom is a book that we've written around dual diagnosis, and there's a family guide as well, which we'll show you the reference for at the end. And that gives some suggestions around things to be doing around a crisis, and particularly now during COVID. I think this might be the next slide, but I'm not sure. We have a sort of tool that can be helpful around planning in case somebody does need to go to the hospital. So we'll be sharing a link to that tool. You find it on the Surrey Place website. But whether you're going because of COVID or you're just going to the hospital right now for any reason, including a mental health reason, it can be really helpful to do that sort of planning for why you might need to go to a hospital and the information you want to have. So we'll share resources for that. And I think that's my piece. And now we're going to turn to Casey and talk a little bit more about, no, actually, there's one more thing. Lee, was it me or you? It's Lee now, right?
Yona. Yeah, I wanted to talk just for a moment about, I really appreciate these 5 treatment principles. To remember that our loved ones with a developmental disability and a mental health diagnosis or concern are people first, that we provide context about their strengths as well as their problems, that mental health problems are common yet under-identified, and although complex and understandable and responsive to care, and that the response to mental health problems must be seen in the context of the whole person. Many people who have mental health problems and developmental disabilities are some of the most vulnerable people in our society and in our healthcare system. For many people, this is a long and complex problem, and family members are the most constant companions in this journey. So I like this next slide about that it takes a team. It really truly does take a team. Advocating, navigating, coordinating, finding resources, and helping to follow through with recommendations are all part of the important role that we as family members can provide. But we cannot do this alone. We need to help to deal with the impact of mental health problems on our loved ones with a developmental disability. We need the perspective, the expertise, and training of other team members. And we bring the expertise of knowing our loved ones best. Sometimes it may feel intimidating to ask questions or ask for clarification, but we hold the knowledge of our loved one throughout the lifespan. and how they best communicate, and giving context for behaviors that challenge. So our voice, along with our loved one's voice, is critical to ensuring the best treatment possible.
Just before we move on, if you could just speak a little bit louder, I think some of the participants are having a little, are saying that they can't hear you as clearly.
Thanks very much. I will definitely speak up. Thanks.
All right, so I am going to talk a bit now about therapy. So there is no one way to do therapy to support mental health of our loved ones with developmental disabilities. We often envision therapy as spending an hour a week in an office with a therapist and client, but there are other ways to do it as well. So as Lee was just saying, the support of family members and having your input is very helpful. So therapy can also include, in addition to your loved ones, it can include you being involved in the therapy or direct support staff. There are also family therapies that support the entire family, not just focusing on one individual. And there's also group therapy where individuals with the same mental health concerns, for example, like a depression group, people can get together and work on similar issues in a group setting. And in addition to having these different types of therapy, therapy also doesn't have to be done for a set amount of time. So it could include a longer session each week or two, but it could also entail a few shorter segments throughout the week, or phone check-ins to see how you and your loved ones are doing. So it can be flexible to meet your needs. And therapy can involve different types of activities. So depending on the communication level of the client, it may involve talking with their therapist about their experiences and reactions and identifying their thought patterns and working with thoughts. But there can also be a lot more behavioral and activity-based skills building within therapy. So just an important message that we want to convey is that individuals with varying communication abilities or varying communication support needs can still be involved in therapy. And the last point here is that therapy will often involve homework or practice in between sessions because therapy just takes up a small part each week, but it's really practicing those skills throughout the week that will make the difference in developing coping strategies for mental health concerns. So the next slide talks about how important it is to involve caregivers in the therapeutic process. And I loved what Lee was saying about this. Although therapists have the knowledge and tools that can improve and support mental health, you and your loved ones are the experts on yourselves and your everyday life, and we need your feedback in order to tailor the activities we do to meet your needs. Some parents have raised the concern about whether their family members whether their information will still be private and respecting confidentiality in these situations. So it's important to remember that just because a family member or another type of caregiver is involved, it doesn't mean that you have to hear about the entire therapy session. So involvement might depend on the client's level of communication abilities and their preferences for caregiver involvement. But the caregiver could be involved just knowing about the strategies to work on each week, not necessarily hearing all the ins and outs of the session. But I do want to emphasize how important it is for caregivers to know what skills that your family members are working on so that you can support them in between sessions, as we know that this practice in between sessions is essential for change. So moving on, I just want to give you an example of one common type of therapy you might hear about, or you may have been involved with already, cognitive behavioral therapy. This isn't the only therapy for supporting adults with developmental disabilities and mental health concerns, but it is a common one, so we just wanted to tell you a bit about it. Cognitive behavioral therapy looks at individuals' thoughts, behaviors, emotions, and physical reactions. And we view these different aspects of experiences as being all connected and influencing one another. So in cognitive behavioral therapy, we can target different aspects of experience to support the mental health of our clients. So that means that even if individuals don't have as much communication abilities or need more support in this area, we can do more behaviorally based activities rather than a lot of back and forth discussion. The next slide just provides some examples of specific programs that were developed for adults with developmental disabilities and co-occurring mental health concerns. So we want to show this slide just to let you know that there are existing treatments out there that we can use with your loved ones. And I will be giving some examples of the types of activities we could do from these different manuals. But before moving on to that, I just want to highlight, as Yona had mentioned previously, that there is a resource that has been adapted. The Step Up resource has been adapted for during COVID. So on the next slide, we have just a picture of the 5 different self-guided or the self-help books that you can access online, and we will be including that in our list of resources that we share with you. And this can be done, like, there's no need for a therapist. Family members or other caregivers can support adults with developmental disabilities to work through these booklets, which could be a really nice tool during this time if you don't have access to your usual support. So, so I saw just a quick comment about where you can access the dual diagnosis resource. So we'll be sending out a list of all these resources we mentioned in the presentation. So one of a key part of cognitive behavioral therapy is emotion identification. So we have found that it's very important for people to understand and be able to identify their emotions and how heightened or dysregulated or calm they are at certain times so that they can work on strategies to manage their emotions. So these are types of tools that we actually do use in therapy, and you can see they're quite visual and hands-on. So emotion identification can be done with any individual who is able to work with these images, and I find it's actually quite nice to do it hands-on rather than just talking generally about emotions. So the next strategy I wanted to present, fun. I don't know if this slide, yeah, thanks. So is about monitoring behavior. So this tool can be used if there is a specific behavior that you wanted to understand better and then work with on changing. So for example, the behavior could be like self-injurious behavior. So this tool would be used in between sessions, and in this case it would be really helpful for a caregiver to be involved in supporting tracking the behavior. So you could look at your antecedents. What is happening at the time of the behavior? So where is the person located? What time of day is it? Who's around? Understanding the general circumstances may show us what types of things are leading to a certain behavior. So then you would B, in the middle column, track the behavior that you're observing, and C, the consequence. How does the behavior end? So does someone intervene? Does just a certain amount of time pass? By tracking behavior over time in these different circumstances, that helps the therapist understand what we could potentially do to change it, and then working with your loved ones and yourselves, we can work to develop plans to change, to help support at home or in different environments. So on the next slide, we present relaxation exercises. So this is a deep breathing exercise, but it's really just one of the many relaxation exercises we have. And I like this tool because it can be done anywhere. And it's really just about calming both the body and mind by calming the nervous system. So this can be a really useful tool when someone's feeling heightened emotions or quite distressed. So I know we don't have a ton of time, so I'm not presenting all the different strategies that you could do in therapy. We just want to highlight some of the more behavioral strategies that if you were to do therapy with your loved one, that you might encounter and might be useful to you. So we have one more to present, which is called activity scheduling. So we often use this when people are feeling sad or depressed and aren't doing a lot of activities in their day-to-day life because they're feeling down. So each day of the week, we would actually plan a specific number of activities related to activities that the person enjoys, activities that give a sense of achievement, physical activity, and social activity. And we found that by actually engaging in these activities, even when someone isn't motivated, their mood will go up over time. So activity scheduling and then tracking can be very beneficial for low mood. So as I said, these are just a couple of examples to give you a flavor of what could be done in cognitive behavioral therapy, but this would obviously always, with certain types of activities and how they were done, would really be adapted to yourself and your loved one's needs. So I'll hand it over now to Natasha.
Thanks, Casey. Hope you all can hear me. So I wanted to start off with the next slide. Yes, thanks, they're fun. And I think that the most important kind of piece of information that I want everyone to take away from my talk today is kind of feeling empowered to get involved with the doctor's treatment decisions and the plans that they're making for your child. And I think often it can be intimidating to speak up or voice your concerns, especially if you disagree with your doctor. But I will echo kind of Casey and Lee's sentiment around the fact that it does take a team and that the caregiver is such an important integral part of that team. So if you are concerned, I definitely invite you to speak up. So I wanted to start the medication talk with actually this slide referencing a study that was led by Yona Lunsky around how medications are actually overprescribed in this population. And there's certainly times when medications are needed, but we're finding more and more often that they're either being overused or not used correctly. So in this study, referenced on this slide from the they found that about a third of adults with a developmental disability were prescribed an antipsychotic medication, but of those who were prescribed an antipsychotic medication, a third had no documented psychiatric diagnosis that would explain why that medication was being used. The unfortunate piece is that antipsychotics come with a lot of side effects, and so should not be something people are exposed to if they don't need it. And what concerned me was that the study only looked at antipsychotics, but I wonder about all those other kinds of medications that are also being prescribed, and it might not be appropriate. So more often than not, by the time I see a patient, they have already been seen by a family doctor, maybe an emergency room doctor, a general psychiatrist, and they're already on a lot of medications. And I find that sometimes my job is to safely deprescribe the medications that aren't working, which can be challenging because sometimes we don't even know why the medication was started to begin with. So how can we prevent your loved one from falling into that kind of 1/3 group? I wanted to start off with talking about the different kinds of medications. So the next slide lists kind of the major classes of psychiatric medications. And I know it can be overwhelming to keep track of all these different kinds as well, not to mention the non-psychiatric medications that your child might be using. But I wanted to maybe share a few thoughts I had about these medications that you should be aware of. And the first piece is that the names of the medications are quite confusing because not all of them are as intuitive as it seems. For example, you can have someone on an antipsychotic, but it might not be for psychosis. And similarly, people might be on antidepressants, but it's not being used to treat depression. It might be used to be treating anxiety or to help with sleep or a certain behavior. So I would encourage you that if you're in doubt, certainly ask your doctor why this medication is being used and challenge them to connect the psychiatric diagnosis to the medication. The second piece of advice I'd offer is to make sure you're aware of the side effect profile of these medications. And that really is the job of your doctor to inform you. And I've listed the medications on this slide in order of severity in my view. So the antipsychotics having the worst side effect profile, with antidepressants being the better ones. However, they all do have side effects. And, you know, there are definitely reasons why your child needs to be on these medications and they're beneficial. However, the side effects need to be watched and monitored. So if not on an every 3-month basis, at the very least need to be watched annually. So for example, the antipsychotics have a risk of diabetes and high cholesterol and high blood pressure, as well as some changes sometimes to movements. And these can be mitigated if we monitor for any of these changes and act quickly if we notice that there is a change. The next point that I'd like to make is that often your child will likely need a lower dose of the medication than most other individuals. And sometimes these medications are started at a higher dose, which can lead to increased side effects. More so, something to keep in mind is that the psychiatric medications alone very rarely completely treat the disorder. So usually they need to be worked in conjunction with many other kind of treatments, and more specifically, a lot of therapies. So for example, if your child has something like bipolar disorder, of course they need to be on a mood stabilizer like lithium. However, I also would advocate for them to be on an organized schedule and make sure that they get a lot of sleep at night in order to prevent a manic episode. And finally, the patient should be part of the decision-making process, and sometimes that gets forgotten, but they are the ones taking the medication, so they should certainly be invited into the conversation. So now we talk about medications for a psychiatric disorder, but sometimes medications are started in order to manage a challenging behavior. And so there are, like a general rule of thumb is that if a patient is acutely in crisis or they're harming themselves or another person and it's a frequent behavior, so it occurs on a weekly basis, there is a role to start a medication, not to treat the behavior, but to manage it in the short term. This comes with many caveats that I don't think a lot of people are aware of. The first is that medical conditions need to be ruled out before you start these medications. And things like tooth infections or constipation should be assessed because it's unfortunate if you're starting something like an antipsychotic when really someone was constipated. So obviously we're not treating the underlying issue. The second thing to be mindful of is that a number of the studies that assess the effectiveness of antipsychotics for challenging behaviors are not the best quality, and they're also not long-term studies. So it's important that when we start these medications, we're always thinking about it just being used as a short-term solution until we're able to find resources like behavioral therapists and occupational therapists to provide kind of a psychology therapy treatment for the behavior. The next piece is around being careful around medications that are being used, as I call, as needed. So your doctor might provide you a few medications that you can use at your discretion to treat a specific behavior. I would caution you around how many of these medications are being provided to you because they can get confusing. So we try to limit those. And I'd also advise that if you find that the medication tends to be given at the same time or on a daily basis, then maybe let your doctor know so that they can prescribe it just as a standing medication. And the final piece is around not stopping the medications yourself, because sometimes it can have lethal consequences, but also if not, sometimes it can just be a very unpleasant experience for your loved one. And unfortunately, if you stop a medication because you think it's not working and your loved one withdraws from it and then starts to express a lot of behaviors that are challenging to manage, your doctor might misinterpret that to mean that the medication was actually working and will just restart it. So that's not very helpful. So I just wanted to end with this slide around how you can kind of be part of this process around medications. And I think the most helpful thing for me personally is when caregivers bring in some form of tracking of behaviors. So either by ways of a calendar or a scale, and Surrey Place on their website has an excellent record kind of sheet where you can note down behaviors. And so you don't have to do this indefinitely, but what's helpful is if you track the behaviors for the weeks leading up to the appointment, and then after medication is started, if you track the behaviors for about 2 to 4 weeks afterwards to give us a sense of if the medications are working. It's always very helpful. Thank you.
So I hope I'm speaking loudly enough now. Is it clear now, Yona? Great. So family members as caregivers, we can supplement treatment, and we know how healthy food and exercise positively impacts our physical health. That there can be allergies to certain foods that develop as adults, so we can be on the lookout for those intolerances. Sufficient sleep, has already been mentioned, is so important, but too much sleep can alert us that our loved one may be struggling. It is certainly been highlighted in this time of COVID, the important role that routine plays. It gives our days structure and predictability, and expanding our loved ones' social connections beyond family and paid caregivers is so important, but it's also challenging. We all need people around us who accept us for who we are, and we may need support to help us think about places that our loved ones can belong and can contribute. That contribution doesn't need to be paid work. It could be volunteering or helping out around the home or in the community. Our loved ones' very presence is a meaningful contribution. They are such important teachers of acceptance and diversity. So the next slide just talks a little bit about our role of family caregivers, family members. Our role is so important in the advocacy of our loved ones' mental health treatment. We have known our loved ones for their whole life, so we hold the history, and that history provides context for the treatment plan. We know if a behavior is a challenge, that challenges is something new, or if it is an expression of a long-standing behavior, but is being expressed more frequently or differently. And as already been said, we can ensure our loved one has been seen by their doctor so that a physical health issue is not attributed to a mental health concern. We know our loved one's triggers, And if there has been a recent environmental change or loss, we can also provide that context. Navigating the healthcare and developmental service sectors is complicated. Our loved ones will need our help to support navigating and ensuring coordinated care. We are the ones who can help follow through with recommendations in therapy and medication. As Natasha just said, to ensure that medication is right at the right time, we should feel open to questioning that. But we can't advocate, follow through, or ask those important questions for clarification unless we view ourselves as an integral part of the healthcare team. Although our loved ones are adults, we need to ensure healthcare providers understand the important role we play. And so while there's a place for confidential conversations between our loved ones and their doctor or therapist, it's important that the team understands that we are integral to following through on recommendations and treatment. So we do know our loved ones best, and our perspective is so important. The next slide, please. This is a marathon, not a sprint. I really like that saying, as it applies to how we're coping with COVID at this time, but also how we're dealing with our loved one who has a developmental disability and a mental health concern. By the time our loved one is an adult, we ourselves are often tired from our years of advocacy. Therefore, it's so important that we take care of ourselves and expand our own circle of support. We cannot do this alone. And the previous slide of how to support our loved one's well-being, when I talked about how diet and exercise, sufficient sleep, routine, and social connections are critical to their well-being, those are things that are also important for our own well-being. We can't keep giving out unless we replenish ourselves. And so we'll be discussing in our June 2nd Lunch and Learn session how we can take care of the caregiver. So we really hope you'll enjoy registering for that session with us. So I'd just like to pass this back to Casey now for the conclusion of our key messages today.
Thanks, Lee. Yeah, so a lot of the messages that Lee was saying, I want to reiterate because I think they're so important. So our first key message is that supporting your loved ones, it takes a team, and you are an integral part of that team, as well as a variety of other people. So it can include your, any direct support staff, other family members, physicians, therapists. Anyone who can help support your loved one can be part of their support team. And also supporting the mental health of adults with developmental disabilities can also include a variety of treatments. So we talked today about support in the family environment from Lee's perspective. Natasha gave some really important information about managing medications, and then I also spoke about psychosocial therapies. So these can all be used in conjunction, and this will depend on the needs of you and your loved one. So our second main point is that your loved one and you yourself are experts. As Lee was saying, you hold the history, you have so much important knowledge that is vital to informing treatments for your family members. And we really want to emphasize how important your contribution and the contribution of your family member is for decision making. And our third point relates to medication. So as Natasha was discussing, there obviously can be benefits to taking medication, but it's also important that they can have side effects that really affect your loved ones. So medications may affect different people differently. So again, just recognizing that there isn't one catch-all solution. And finally, I know we've been talking about this throughout the presentation, but we really want to emphasize that treatments do need to be adapted to individual needs. And to be effective, we need to get your perspective and your loved one's perspectives of how things are going, and we need your input and ongoing work to make sure that we can support you as best as possible. So those are our key messages, which we were hoping you took away from this presentation. But now we do also have time to answer some of your questions. So I think my understanding is Irfan will be helping us out with that piece.
Mm-hmm. Thank you so much, everybody, for sharing your thoughts so far, to all our panelists. Yeah, we now just want to open up the floor for any questions. If you guys want to put them into the chat box, and I can read them out and ask the panelists the questions. So we have one question so far asking, how do we get a copy of the booklets and chart printouts? And I want to say that that is a resource that we will be sharing with all of our participants via email after this webinar. We'll be providing access to the online versions of those. There's also another question asking about the recording of this webinar. So this webinar is recording will also be provided online, and we will share that link with participants as well.
And actually, on our YouTube page, you'll see the link to this webinar, but also the 2 prior webinars in case you missed them. And then we'll post our last webinar also, not to discourage you from going. Hopefully you will all come. But sometimes we can't get to everything because there's so much going on at the same time. So we are recording all of these. I realized on our questions page here, we've given a lot of information about H-Card, but we didn't include our COVID H-Card page here. Maybe we'll stick it in the chat box. But if you haven't seen it, we're trying to put a lot of our resources, including the mental health self-help booklets during the time of COVID that came from our colleagues in Scotland. You can see a lot of those things on our H-Card COVID page. So the website is hcardcovid.com.
We have another question here. Ruling out underlying medical conditions can be very complex in this population because of rare genetic conditions that are not well understood or researched. Referrals to specialists can be extremely time-consuming. What can be done to improve this?
That's a really great question. How about I start with it, and maybe Natasha, there'll be some stuff that you want to add. So first of all, we do have a whole webinar talking about sort of the complexity of assessment, but I think your point is well taken that, when we're thinking about treatment, we can't forget again about assessment. And a big part of that, a model I like to follow is a really simple acronym called HELP. So if we're going to be treating issues, we have to think about the H, the E, the L, and the P. The P is the psychiatric stuff, and we get to that last. But the very first thing we have to be thinking about is sort of underlying conditions, underlying health issues that might be contributing. So it's really helpful to understand if someone has a particular genetic condition, what do we commonly see in that condition, both medically, socially, psychologically, and how can that be contributing to the problem? And going back to Lee's point about expertise, you might see a psychiatrist who knows a lot about mental health issues, but they do not know necessarily about that unique sort of genetic syndrome that your sibling or son or daughter has. So that's a way you can help the team do their work by helping them have that knowledge. It is difficult sometimes, as you say, to get that specialist consultation, and it may be quite a wait before you see the people who have that absolute expertise. So if we go back to that early slide I showed about different kinds of expertise for different issues, there may be some work we can do early on that is still supportive of the situation before we get to that integrated, specialized group we want to see to help us that's in the top right-hand corner. So maybe people who know a lot about developmental disabilities may not know so much about mental health, but understanding that unique developmental disability is really important. Or maybe even the primary care provider that you're already working with who knows you and your family member super well, knows a fair bit about that condition, but just doesn't know sort of what it means in terms of the sort of mental health issues that are emerging. So bringing that team together who understand both the condition as well as the person, I think are really important pieces.
I don't have too much more to add to that, but other than to completely agree that unfortunately, because a number of these conditions are fairly rare, most general doctors don't have a ton of experience with them. So certainly don't be afraid to voice your concerns that this needs to be addressed by a specialist and that they need more like specific care around.
We have another question in the chat. Recommendations to find a therapist that is skilled at working with individuals with developmental intellectual disabilities, as well as ones that are willing to be creative in their delivery of service, not just doing talk therapy.
I can try to answer this, and Yona, feel free to jump in as well. Resources available, for example, through Surrey Place and Adult Neurodevelopmental Services at CAMH. Surrey Place does provide more psychological support, but these teams can also connect you with other services. For example, the social workers on these teams have quite a lot of knowledge about supports available, at least in Toronto, for adults with developmental disability, and who in the community, whether it be privately or publicly funded, can provide support. So I'd say, especially the Surrey Place website, I know we've included a few tools from this, can be a really good resource. I find, depending on the types of services you're looking for, I have also done some just Googling, like Toronto, developmental disabilities, autism, and also found a number of clinics who provide support, but Yona may have more explicit recommendations.
Well, I think it was a great question, because it was looking both at kind of who's a specialist, how do you find people, but also who's flexible. You know, and I go back to this slide that happens to be up, looking at the sort of 4 quadrants, right? And there's some people who know a lot about mental health, but maybe they don't know quite as much about the unique situation of your sibling or son or daughter. You know, but if they're open to learning and being creative and thinking about how to adapt things, that could be quite helpful. I mean, there are resources out there that guide us as clinicians to figure out how to adapt my care. If I'm seeing someone who has a sleep issue, it's insomnia, and it's the first time I'm doing that, you know, sometimes if I know a lot of other things about that person, but I'm not as familiar with insomnia, I might say, well, you know what, I've got this information that gives me this like really well-studied way of treating insomnia. Let's give it a try and talk together and see how it goes. Right. So you might be seeing a therapist who says, well, I haven't actually worked with someone with a developmental disability, but I've worked with kids, and I know sometimes how I modify interventions that I do with adults, with children, or I've worked with some older people, or I've worked with people who have brain injuries, or I love art and it sounds like your kid loves art, so let's just see what we can do, right? So a lot of what we're doing sometimes is trial and error, and we're looking for people who want to have a really good relationship with us and who are willing to sort of explore things and be flexible, and adapt what they do. So someone who says, I only do this and I've only ever done this and I don't feel comfortable doing that, they're kind of saying to you like, hey, I don't feel comfortable here, right? But someone else might be saying, well, I could work with you. We can try this and see how it goes. And maybe that's what you're looking for sometimes, because not everyone has experience with every situation. You know, that's the truth. But if we're flexible and we know how to use the resources that are out there, I think it can still be helpful. A lot of what makes therapy work, we've learned in studying sort of why therapy works, a lot of it's actually about the therapeutic alliance and the relationship. And some of these things we call common factors in therapy. So it's less so much because you delivered the therapy exactly in this way, or you did this intervention. It may be that a couple of interventions would be similarly effective potentially. We're looking for things that don't harm the person, for things that help the person, for that engagement and relationship. And those things make a difference. I don't know if anyone wants to add anything there.
Yeah, I guess just one piece that was based on the response to the last question and this one as well is to reiterate that also clinicians, even if they don't necessarily have experience working with developmental disabilities, sorry, They can also consult with their colleagues. So I know that's something that I've been doing a lot with this year is colleagues I know who are working with individuals with developmental disabilities who don't have that experience will have like some brainstorming sessions about how they could be flexible, as Yona was saying, to still work with the same clinician, but adapt their practices to be a little bit more client-centered.
Perfect. So another couple of questions coming your way here. The next one is, do you recommend any online phone app types of documentation that would be useful and match your material?
Again, looking at this diagram, everyone just tattoo this diagram to your arm. No, I'm teasing. But there are a lot of things that are out there designed for the general population. Sadly, and we're learning this right now during this pandemic, people with developmental disabilities, we haven't really created quite as much for them in terms of apps and online resources, right? So this is kind of a newer area. We have less evidence for how those things work with this group. But depending on, who the person is that we're talking about, it may be that some of those things that have been designed for the general population might be helpful. And again, it might be general population, and might be looking at resources that have been developed for children, for example, that might be helpful. So sometimes we can adapt things that are there for other groups, and sometimes we need to sort of develop and study things that are more unique to this population. I think in the next couple of years, we're going to know a lot more about some of these online kinds of resources. I think one thing I'm learning, just trying to, I wrote a blog. I thought I knew everything about a month ago, and I wrote a blog saying we've got to get more tech into this community, right? We have to do more tech, more online, more resources. And I kind of realized in working with people with developmental disabilities that, if they weren't comfortable using this tech in the first place, we can't suddenly throw it at them and expect it's going to really work. So some people really respond well to like reminders and things on their phone, to visuals, to things where they can just pick sort of a mood and tap on it, or they can hear it on the phone and they can read it. And some people are not able to do any of that stuff. So we have to be able to sometimes coach or support somebody to use something that's online or more digitally based. So almost like digital plus, so digital with coaching, digital with another person looking at it with them at the same time, taking a resource that's online, watching it and talking about it together. So I think where we get it wrong sometimes is we say, well, we sent you our website, didn't you see all these awesome resources? And it's really about how we interact with those resources and use them together. Another thing I've learned is that sometimes all of us actually need a bit of repetition, and not to be afraid of that. So even if we've looked at a resource and we've talked about it that's online, maybe we need to listen to it multiple times, right? Maybe we need to kind of engage with it in different ways for it to make sense to us. So we need to read it, then we need to ask questions about it, then we need to talk about it, then we need to read it again, and we need to post an image of it up on our wall or get a reminder of it every day. So certain things like that I think can help us using some of the digital things that are out there. We'll never see as much digital stuff as we're seeing right now. Well, hopefully in the future we'll see even more, but this is the time, I think, to look at things that are online. And I think it's a little bit of trial and error as well to see which things are sort of helpful for the person in your family.
Okay, next question. Can you share any strategies to helping with emotional control, controlling excitement and controlling upset/anger?
Yeah, so like I know I very briefly alluded to like emotion identification being a first step that's really crucial for someone being able to work on identifying their emotions before being able to regulate them. So here we have a resource from the Zones of Regulation, which is actually a whole program for working with identifying emotions and developing strategies to work with these emotions depending on which zone you're in. So this is often can be done with the support of a therapist. Sometimes it's even done in classrooms or different group settings, but also different relaxation strategies can be really useful. So I had mentioned deep breathing. I'm just kind of giving a general. I don't think that the feedback we give now can be catch all, go home and do it, but these are just some strategies that might be useful for you. So there's things like deep breathing, progressive muscle relaxation, mindfulness exercises, but again, it depends on the person, what works for them, and sometimes this can take some trial and error for sure. But these are some of the just initial ideas I have. I don't know if anyone else wants to jump in and add to that.
I just, as a caregiver, I notice that the more I'm anxious when I'm responding to my loved one's anxiety or anger or whatever, really also seems to just make it worse. So taking, again, I know it sounds so trite almost to take care of ourselves, but some of the strategies that Casey just mentioned, relaxation exercises or mindfulness or just something that can soothe ourselves when we're feeling our own anxiety going up. It's just so important. I feel that fear, I get fearful, then I respond out of my fear, which then impacts how I'm coming across. So I just wanted to add that in, that my own sense of well-being is really important. And even if I have to step away and get grounded again myself before I give yourself permission to do that, so that when you go back in to support your loved one, that you are feeling a little bit more grounded. I just found that helpful. Otherwise, it's sort of my reaction is affecting my loved one's reaction, and then it's back to me, then it's back. It's like a very out of control, back and forth, which just ends up having a worse outcome.
Just to add, and I'm sure, Micah, you probably know this better than I do, but prevention is always better than the cure. And so if there's like certain triggers for the anger that you've kind of noticed, and trying to mitigate that is always helpful beforehand. Like, for example, myself personally, if I haven't eaten or I'm hungry, I get quite cranky. And I think this is something that can be shared with other people as well. So try to make sure your loved ones fed, that they've gotten sleep, their schedule hasn't been changed, or anticipating that can also prevent outbursts.
Another question that we have is there genetic testing available?
So genetic testing, that's a big question. If you look at what we call these sort of primary care guidelines for adults with developmental disabilities, which I encourage all of you to be aware of and share with your family physician in case they aren't aware of them, and we'll share the link. When we mention Surrey Place, we're often talking about the primary care sort of tools and guidelines that were led by Surrey Place as opposed to just Surrey Place. So we'll send the link to that. But it is a really important guideline for all healthcare providers that we should know sort of what the cause, ideally, of someone's developmental disability is, which may include genetic testing. And one sort of point to keep in mind is that even if somebody had genetic testing when they were a kid and it's now 20 years later, there are different kinds of tests that we can offer now that maybe we didn't have 20 years ago. So there's a resource actually through Surrey Place that sort of outlines where some of the genetics centers are. So how you'd be able to work with a geneticist who works with adults to see if it would make sense to go through genetic testing for the person in your family. So it doesn't always make sense, but it is a good question to be asking. And there are resources to help your healthcare provider figure out how to do that piece.
I think we have a couple of more questions if we only have a minute to go. So I guess we can ask, we'll go in the order in which they were received. What more do you feel needs to be done with clients with DD who are justice involved?
Wow, we could have a whole session on this. These are amazing questions. I'm sorry we're not going to be able to answer all of them. They're big questions that deserve a lot of attention. So what we can do is at least take a look at these questions. You can continue to reach out to us at hcard@camh.ca if we don't get back to you to think about these things. And it also gives us good advice on what other kinds of things we could be doing these family webinars about. So one thing that will happen after this is over is you'll get a little survey in addition to links to our resources and the video of this presentation. And we encourage you to fill that out and tell us what other topics would be really important. There is a resource related to justice and sort of forensics in people with developmental disabilities that was put together by the Community Networks of Specialized Care. We can share a link to that resource, although it's more for clinical and community providers than it is for families. But I think some of the resources in our family guide to dual diagnosis might be hopefully helpful to you if you haven't seen that already. Respecting everyone's time, because it is 1 o'clock and there's a lot of stuff going on for all of us right now. I want to say thank you on behalf of everybody for joining us. Sorry if we did not get to answering your question, but like I say, feel free to bug us. Sometimes we just need another reminder, but we will try to answer the questions that you have. And we really appreciate that you took the time out for yourself to learn something that will hopefully benefit you and your loved one with a developmental disability. And thank you, Casey, Natasha, and Lee for speaking with me today, and Irfan for organizing and hosting. And we hope to see you guys again next month to talk about self-care, because it matters. Be safe, be well.